Yeah.
There we go. So we're going to start recording. We do have closed captions on for anyone who is with us. And so here's Carrie Poser, the director of the Wisconsin Balance of State. Thank you.
Hi, good morning. Yeah, I have a slide deck that I'm going to run through, and then I have a few handouts that I'm going to send. I'm assuming I'm going to send them to Beth, that I'm going to put up on the screen, and we're going to talk about. Sometimes some of the information is hard to talk about in a slide kind of setup, so I have found that putting them into like handouts kind of works better. So you can give me feedback if you think that that'll work. As I mentioned, my name is Carrie Poser. I'm the director of the COC for the Balance of State. I've been doing it for a bit. I'm based in Eau Claire. I appreciate the invitation to come and chat. I was looking through my notes. It's been a while since I've talked with the Brown Coalition. This is what I have up on the slide for kind of today. So I have the slides and the handouts, and then the items on the right-hand side are kind of the buckets that I'm going to talk about, with a lot more time spent on the data-driven decision piece at the bottom there, laying out from where I sit. When I look at your data, these are the trends, these are the things that I'm seeing, in the hopes that it will spur some conversation amongst you all about why that is, because there are some things that you'll see that I don't necessarily have an answer to as to why it looks the way it does. But there probably should be some discussion around. So we will jump right in. I did want to ask how you wanted to do questions, because I'm certainly open to answering questions. I'm just not sure the best way in this format to do questions.
Would it be best if we waited till the end? So anyone here can write down their questions, and then I will save the questions that come up in the chat.
Sure, I can certainly do that. I could also pause kind of in, there's kind of some natural points. So how about, so I'll pause after the first couple of points, and then I can pause, because the data stuff, if people don't understand it, I don't want to get way, 45 minutes into it, and then they're like, wait a minute, I didn't understand slide 3. So does that make sense?
I think that'll be perfect.
Okay, cool. Okay, in most of the presentations that I do, there's just some basics that I want to make sure that we talk about. Most people, when I was kind of looking at the list here of who was participating, I know and recognize many of your names, that you are normally involved in homeless services. So some of this might not be new information to you, but I did want to level set for those that I recognize as being new to this space. So the Hearth Act. If you've been doing homeless services for 10 years or so, you'll know that the world changed a little bit. Things started to feel a little different in the way that we were organizing and structuring homeless services, data collection, the emphasis on data and performance, things like that. That did not just come out of nowhere. It actually came out of federal law that was designed for lots of reasons, but one part of it is what's on the slide. It was a push to create COCs as systems. A COC sometimes is referred to as like your local coalition. We used to call you all little COCs. And the big COC, that was super confusing. So now you are local homeless coalitions, and the Balance of State that I work for is the actual COC. But regardless, we're designed in order to create system structure, as opposed to everybody just using their homeless money and doing what they want with it. We're supposed to be developing a community and a coordinated response. So that's where many of the requirements flow from, between federal law and HUD guidance and expectations, and then of course contracts for funding. And that's like a whole nother slideshow that I could do all about that. But this one slide, for those of you that aren't familiar with the balance of state structure, this is my one slide about that. There are 4 COCs in Wisconsin: Dane, Milwaukee, Racine, and everybody else. Balance of state is everybody else. Brown Coalition is a member of that nonprofit organization called the Balance of State Continuum of Care. The mission of the organization is to end homelessness. There are 21 coalitions. As I mentioned, Brown is one of them. And if we're ever going to talk about what ending homelessness looks like, you have to define it. Whether that's at your local level and local conversations, or at the balance of state level, I think it's important that we know what we're talking about when we refer to the phrase ending homelessness. It means different things. On the screen is our definition, which is that we're going to have a response in place. That's the goal, is to have a response in place that ensures that when we can prevent homelessness, we do, and when we can't, it is a rare, brief, and non-reoccurring experience. That is what ending it looks like. If that's your definition, that is what it looks like. A little bit more about the balance of state. It's a little history lesson. We meet quarterly virtually as of May 2020. We will have our first in-person meeting in February of 2024 in the Jefferson Inn in Wausau. So that'll be a stay tuned. I don't think we'll go back to 4 in-persons ever. I think that we will be looking to go to just having 1 in-person conference a year and then have virtual meetings the rest of the time. The board of directors meets virtually monthly. I'm the director. I have 5 staff. They are scattered throughout the state. And then we as an organization have a bunch of federal grants that flow through us, as well as the Domestic Violence Rapid Rehousing Grant. As a map, I do this generally for context because some people don't realize just how big we are. So Brown is this blue little square right here. Everything else is also the balance of state except for Dane, Racine, and Milwaukee. The color represents the different coalitions. So you are a 1-county coalition. There are others, especially to the west and north, that are many more counties. Both from your local level and from your big COC level, it is important that we are getting perspective from a variety of folks that serve in different positions within our community. In purple, you'll see the nonprofit homeless providers and the emergency shelters. Those are our, what I would say, most common providers that attend local coalition meetings as well as COC meetings, but they are not the only people that should be coming to the table. Every coalition looks a little bit different in terms of who they already have showing up. We challenge every coalition as well as the COC itself to make sure that we are expanding as much as we can to include as many different kinds of providers at the table. That can be a process as well as a challenge, but it also can be rewarding in that it brings new perspective outside of the HUD box thinking, additional funding sometimes, leverage, and other partnerships that we're not thinking about when we bring other folks to the table. So this is a reminder that we can always expand and include more people when we're trying to address a community-wide system-level challenge, which is homelessness. Okay, so one of the first handouts that you're all going to get is going to be about the homeless crisis response system. An effective crisis response system can identify and quickly connect people who are experiencing homelessness or at risk of experiencing homelessness to services. It works, and the emphasis on the system is important because it aligns you as a community, the programs, the services, all around one common goal. I can tell you that in other communities, finding that purpose, connecting to that one thing, creating a plan, is what brings in funding from places outside of your traditional HUD or the state or whatever. Folks have organizations, especially not nonprofits, have funding that they need to invest back in our communities. They're required to do it. It's really hard to fund something when there isn't a plan. And when you come at it as a coalition level kind of commitment to this thing, and there's all these partners and there's all of this work being done, it is a lot harder to say no than if you're one agency asking for funds for one thing. That's just my side note, but I have seen that be successful. So, homeless crisis response system, the handout that you're going to get looks like this. Can you see, are you seeing what I'm seeing? I just want to make sure. It's a PDF. It says handout number 1. Or are you still seeing the slide deck?
Okay, we see it. I was
All right.
muted. Sorry.
No, it's okay. I just want to make sure. So the homeless crisis response system, we talk about what a system is, and then this is a quote from the All In. It is the new federal strategic plan to prevent and end homelessness that was just released this year. I used to have a different quote on there related to the previous plan to end homelessness, but this is the new one. Homelessness has no place in America. All In, the plan, is a multi-year interagency blueprint for a future where no one experiences homelessness and everyone has a safe, stable, accessible, and affordable home. It serves as a roadmap for federal action to ensure state and local communities have sufficient resources and guidance to build the effective, lasting systems required to end homelessness. While it is a federal plan, local communities can use it to collaboratively develop local and system level plans for preventing and ending homelessness. I say all those words to you because it is an important difference between this plan and any other federal plan that we have seen come out on how to end homelessness. This one is very heavy in what the federal government needs to do, as opposed to previous plans, which were like 200 pages of telling us what else we need to do locally. And that's fine. You can share with us all the best practices and the things we need to do. But if we don't have federal support, federal funding, additional pieces to this, we can only do so much. So this particular federal plan is very heavy in what the federal government needs to do differently. Remember from the very, I want to say like third slide, where I talked about federal statutes and the Hearth Act. Well, in the preamble of the Hearth Act, it lays out that the federal goal for ending homelessness is to return people who become homeless into housing, permanent housing, within 30 days. That is their window of success, is 30 days. So I want you to think about in your communities and the people that you serve, once they become homeless, can you get them back into housing in 30 days? That's a big stretch. There's no community in the balance of state that has that as the average, whether it's to shelter and then to housing or from homelessness to housing. 30 days is a real tight window. In the document, there are the different parts of homelessness, or different parts of the system. So prevention, outreach, intake and assessment, diversion, emergency services, supportive services, transitional housing, and then permanent housing, both rapid and permanent supportive housing. And I'm not going to go through the whole handout, but I do want to kind of make the connection that each of those components is important. You really can't have a system without having all 8 in some way, shape, or form. In some communities, you need much more, say, emergency services than you do in some other communities. and how much you need of something is really dependent on the human beings that are experiencing homelessness in your community, not only the needs and challenges that they have, but also what they want. What works in one community, say for something like transitional housing, may not be the thing that the clients want. It might not be the thing that addresses the needs that they have or that they're identifying. So it really depends. This particular graphic, a different community requested a graphic about the system. I did not make this up. This came from the National Alliance, but I think that it does a good job kind of laying out where all of those components to the system, how they all kind of work together. So in the handout, it identifies what it is. So prevention, for example, and prevention, targeted assistance to help those at risk of homelessness maintain their housing. There's some examples of what that could look like. And then questions that your community, your coalition should be asking about the prevention programs that you have. How much is needed? What types currently exist? Are they successful? What does success look like in prevention? And who are you targeting for those prevention services? And the entire document kind of goes through that for every single one of these, kind of a description, an example, and then questions to ask, a lot of which has to do with, are they successful? Just because you have a component doesn't necessarily mean that it is meeting the needs of the people or the providers, or it's doing a good job. And if you don't actually look at that as a community, as a system, they might be doing a great job to their funder, but that doesn't necessarily mean that it is meeting the needs that we think it is. So that is what that document is. Before I go further on the homeless crisis response system, I wanted to make sure to pause for a second and see if anybody had any questions. Also, so I could drink coffee. Okay. If there aren't any questions, then I'm gonna keep on going. Oh, there's a question.
Could you make it bigger? That's what people are asking for.
Oh, yeah.
Perfect. Thank you.
Sure. So here's the prevention one as an example.
Are we gonna have access to this on the time?
Yes, so this is currently being recorded. So the handouts and the recording will be sent out as soon as they're available.
Yep, I will send them out right after I'm done talking.
Sure thing. There's one question here.
Sure.
Hi, Carrie, this is Jen Schmel. Just curious, I mean, these are great questions for community thinking about, but like, are there any viable examples from other communities that are working in that space of prevention and being successful that you have access to as someone who has more visibility into the rest of the country and not just Wisconsin?
Yeah, that's a good question. There certainly are really good examples of each of these components. I'm glad that you said nationally, because I would say that there aren't always fantastic replicable examples happening always within the communities that I cover. So prevention is one of those complicated ones in which, as you all know, buckets of money came streaming from the sky during COVID to try and keep people housed. And some communities did certain things with those funds. Statewide, we did not do what many other states did with that, with the we call it WERA in Wisconsin. Other states did other things with that money. They did statewide rapid rehousing, like a TBRA program with case management. And they are seeing a lot of success in that realm. We did not do that in Wisconsin, nor is there any data to really show that the funding kept people housed. Unfortunately, because of that, I can't tell you whether or not where it was successful. When we look at prevention from a specific, not eviction prevention, but looking at it as prevention from keeping people from becoming homeless, because we know that just because you are evicted doesn't necessarily mean that you become homeless. From that standpoint, there are very few communities in Wisconsin that before COVID took prevention money, specifically from the state. Maybe they have prevention dollars from other entities within the community, and they were using it on a smaller scale to address certain things, but not in some big like system level prevention. I think it's an interesting, that one in particular always is interesting to me in that lots and lots of people, non-homeless service specific people, want to talk about prevention. They want to help figure out how to stop people from becoming homeless and go upstream. And that's a good thing. We don't want people to become homeless. It is more traumatic when they become homeless. It is more difficult to get them rehoused when they're homeless. So going upstream is fantastic. You'll get all kinds of attention around from healthcare and from other big systems about prevention, but they don't always come with dollars to provide the service. And that's where we fall down, because in the homeless service realm, they're already homeless when they come in our door, or real close to it. So I think that prevention is one of those things that if I look statewide nationally, the places that have robust prevention related programs that are really digging into going upstream, they absolutely have commitment and engagement from other systems of care, like healthcare, being involved and participating and funding some of those efforts. Does that answer your question?
Sure.
Okay.
One quick follow-up.
One quick follow-up.
Yep.
Doesn't HUD not, HUD doesn't fund anything for prevention, correct? Like the NOVA and all that stuff. Still.
Does HUD fund anything for prevention? I know that EHH funds have prevention dollars, but they have like so many restrictions. But in the current COC NOFA, is there anything for prevention funds?
Sure. So I have two answers for that. Yes and no. So HUD, as we know it to be the COC competition, will not fund prevention unless a community can demonstrate, and when I say community in that context, I'm talking about the COC as a whole, can demonstrate that they have, in quotes, ended homelessness for people that are experiencing category 1 homelessness. So that means we need to see a substantial reduction in folks experiencing on the street or sheltered homelessness. If we can do that and demonstrate that we are, quote, a high performing community, then you can utilize some of those funds that we have for homeless programs. You can use that instead to do prevention work. But as you can imagine, that means we have to do a really good job of ending homelessness before we're allowed to use that same HUD money for prevention services. I will say in the current NOFO that was released last week, there are a couple of interesting ads, and unfortunately they have not released a lot of information about them, but there is some information that leads me to believe that while it's not prevention per se, they are looking at expanding some of the available eligible activities for those communities that are considered rural. Now, I know that in Green Bay, you're probably like, well, that's not us, except that they don't look at Green Bay alone as a thing. They look at the balance of state as a whole as a thing. So if we are considered rural for HUD, there may be some expansion to some eligible activities that we can do. I just don't know that yet, but it is definitely something to be staying, I'm going to say stay tuned in that way.
Okay, Jen Schmo's done now.
Okay. Let me ask you this. Would it be helpful to go through these, or are you comfortable with me kind of moving on? I want to make sure that people have a chance to ask the questions, because I think those are really great questions. I can certainly talk about each of the components kind of really briefly. Do you feel like, or do you want me just move on?
You can talk about them really briefly and then.
Okay. Cool. One of the other components is outreach. So that's the intentional efforts to engage people that are unwilling, unaware, or unable to enter into emergency services. So oftentimes we call it street outreach. With street outreach, again, that became a really popular thing, and lots of people are writing funds for doing outreach activities. Understanding who is doing outreach in your community, what is their target population, what are their hours, when are they going out, what is a success for an outreach worker looks a lot different than what success might be for a housing provider case manager. So making sure that at a community level, you are aware that success for an outreach worker might literally be getting somebody to give them their full name and maybe agree to talk about emergency services, or maybe even agree to talk about housing. It might be a different level of success. Unfortunately, I have seen in some communities where they try to hold the outreach workers to the same level as a housing case manager, and that's just not their scope. That's not what they're trying to do necessarily. They're trying to build relationships, and that takes a long time. Especially with people with some inherent mistrust. So outreach is an important piece. It's just important to know who's all doing it. Intake and assessment. Most people are familiar with that, I think, which is a switch that was required by the federal government for us to change the way that we intake folks into housing programs. It was no longer going to be okay to continue to do, first come, first serve into our programs. And so we needed to find a way to make sure that the people that needed the program the most, with the highest barriers that were going to be the hardest to serve, got in first. And I know that did not sit well with many people and programs across the balance of state during the transition. But it is unapologetic by the federal government. They are not going to backtrack from this idea that HUD money is designed to serve people that are hard to serve. That's where they want the dollars spent. That is what the focus is. So the balance of state used the VI SPDAT. For those of you that might not know, we are in the process of changing the assessment. There's a work group that has been working quite a lot on developing a new assessment. As you can imagine, that process is not quick and it's not simple to make sure that it doesn't end up looking like the VI SPDAT, just in a different context. And making sure that we're getting input from all kinds of people, from all different perspectives, to make sure that when we do this change of the assessment, we don't have to, basically, we don't just release it and then scrap it and do something different. We want to try and get it as close to right as possible. So that's a stay tuned kind of thing. When that does come out, we will no longer be using the VI SPDAT. Coordinated entry, I'm going to talk about it a little bit more in the presentation, so I'm going to come back to that one. Diversion. Diversion is a concept that has to do with problem solving. It was kind of pioneered and earmarked by the veteran community as rapid resolutions. It's basically the idea that we're going to try and get people to stop, give them a minute, and let them try and access and utilize natural supports rather than go right to the front door of the shelter. is there a way to keep people in their situation that is safe, with some support, conflict resolution, things like that, rather than basically entering them into the homeless service system. Emergency services is what most people think of. It's emergency shelters. It can be hotel motel vouchers paid for by the homeless service system or other organizations like police department, oftentimes, or other community providers. Questions to ask in regards to the shelter structure. You know, it seems maybe silly to say, but is their goal to end homelessness? Not all emergency shelters are created equal. Not all of them exist in an effort to end homelessness. Are they doing diversion, or they just let everybody in with their screening process, but they're not stopping and asking some of those questions to ensure that the people that are coming into their shelter really have no other options. Is the shelter using or connected to coordinated entry so that there is an endpoint, that there is a way out of the shelter system? Is there case management to help them self-resolve if that is a component? I'm going to talk a little bit about shelter numbers and self-resolve in a minute too. Is the shelter housing focused? Are they low barrier? Are there lots and lots of rules? Are there lots and lots of hoops to jump through to even access the shelter? Sometimes in communities, there are shelters that are not necessarily connected to the homeless service system that purport to be crisis services, when in reality, they're more like transitional housing. They don't just take people in. You can't just show up at the front door. There's a whole enrollment process. There's a big piece to it. So knowing more about what it means to get into a shelter and how that actually works is an important series of questions to ask. In your community, you have a lot of shelters. And for the size of your community, that makes sense. There are many, many coalitions in the Balanced State that have next to no shelters. So when you guys look at your housing inventory chart and it's like 15, 17 lines, there are some that have none or maybe one. Supportive services. This is what I would call the whole point. The whole point of the game, and I know it's not a game, but it's the whole point of this process, is that we need robust supportive services to help walk alongside humans that are experiencing homelessness. If they could do this themselves, they would. They need help navigating the complex systems that we have created. And so making sure that the people that are doing that supportive services are supported, they're trained, and they have the skills necessary to do the work. Transitional housing is a model of housing, real popular back in the day, not so much. And now that we've seen a bit of a resurgence in certain communities about certain populations. The idea around transitional housing is that they leap from one homeless situation into a temporary housing situation to then leap into a permanent housing situation. The challenge with the leaping is if there's no place for them to transition to, then they are stuck in a transitional environment and or end up homeless again when that transitional time is over. So that is a challenge. Then we have the different kinds of permanent housing options. So permanent housing includes things like housing choice vouchers, HUD-VASH vouchers, mainstream vouchers, family unification vouchers, emergency vouchers, the EHVs. Those are all considered permanent housing resources. For programming, we have rapid rehousing. Rapid rehousing gets kind of a bad rap in that people think it means that they get housing fast. And while that's true, that it definitely is designed to be quicker, I think the key part of it that got missed along the way is that the goal of rapid rehousing was to get people into permanent housing before they fix their world's problems. It's getting people into housing and then working on all the things that they need to work on to maintain the housing. Doesn't necessarily mean that you're homeless day one, day two, you've got a housing unit. Rapid rehousing, you know, how much of it exists in your coalition? What's the target population? What's the level of case management? And are they successful? EHH from the state that was mentioned earlier definitely funds rapid rehousing, but it does not fund rapid rehousing in any kind of robust way, and certainly not to the degree that is needed to serve folks with higher barriers. And so I'm going to talk a little bit about the light touch rapid rehousing versus intensive case management rapid rehousing, and there really is a difference. Permanent supportive housing, this is the idea that there is not a time limit on how long they can be in the program. It's as long as they need it and want it. Generally, there are requirements around a disability. And then for the COC funding, it is chronicity, being homeless a long time. So those are really the components of the homeless service system. If there are questions, otherwise I'm going to flip back to the slides. And this is where you're going to tell me that I missed stuff. And that's okay. So I took a stab at, oh, here, hold on. Let me go back to the actual slideshow. Here you go. This was my attempt at putting down the programs or the agencies that you have in your community that provide the services we just talked about. And I'm sure that I missed some. So under the prevention component, we have a whole slew, I think 6 different agencies that I was told provide different variations of prevention services. So a point of conversation, it doesn't have to be right now, but for you all is this list accurate? Are we missing stuff? And then digging into what it is that each of those folks do, who is their target population, etc. Outreach, these 6 organizations, House of Hope, New Community Shelter, Vivint Health, New Cap, St. John's, and then the Wisconsin Department of Veteran Affairs VORP program. Emergency services, as I mentioned, you guys have a ton of emergency services in your community. Freedom House, Golden House, House of Hope, New Community Shelter, St. John's, Foundation Rise Shelter, apparently House of Hope goes on there twice. That's an oops on my end. New Cap, Salvation Army Green Bay, and Wise Women Gathering Place.
Carrie, can you make this any bigger?
Can I make it bigger? I don't know. Can I? I don't know if I can do that in the slideshow, but I can take it out of the slideshow. Let's see if I can do it. Can you see it any better there?
Yes, that's better.
Okay. So those are the agencies. Obviously, I did House of Hope twice. So before I screw that up, I will take them out. Change my formatting.
There is some notes in the chat that Wise Women's Safe Place Parking Program is considered outreach, and Streetlights Outreach, sponsored by Whatsoever You Do, is an outreach effort. And I'll take notes on these. You don't have to add them right now.
Okay, no, that's good, but that's great. Because that's exactly what, from my perspective, especially around prevention and outreach, they're not on the housing inventory chart. They're often not funded by HUD funds. I'm not necessarily aware of them. So that's really fantastic. If that could be sent to me, I certainly can add them into the slide deck.
And there's another comment from Bev at Wise Women Gathering Place saying that there's a movement for vehicle residency as a HUD category. Are you seeing any shift in dialogue about this?
I don't know about dialogue, but I know that the conference I'm going to next week in DC, there's an entire session on safe parking, and that role that it plays in communities. So I can't remember if that's one I was going to attend or try and get the slides for, to figure out how that is working, mainly because not only do you all have it, but then also in the Rockwall Coalition, you have it there as well. So it is something that I intend to figure out how that's working on a larger scale. And I know that there's a session about it at the national conference.
Thank you.
Absolutely. Those are my others in the called front door services, which is like the front door of the homeless service system, House of Hope's Youth Drop-In Center, and then New Community Clinic Healthcare for the Homeless program. I didn't know exactly where to put them, so they went into my other category. And there certainly could be more, and I encourage you all to have that conversation about what are you missing when we're looking at services being provided under those components to people that are experiencing homelessness. When we look at housing, so in rapid rehousing, you have 3: Golden House, House of Hope, and New Cap, all provide some level of rapid rehousing in the community. Permanent supportive housing, you have the Milwaukee HUD VASH program, New Cap, and the Oneida Nation Tribe VASH program. And then in transitional housing, you have a slew of them there as well. Sorry about that. I'm not going to say this name right, so somebody wants to say it.
Ecumenical, but you can just say EPH.
EPH, I like it. Lutheran Social Services, New Cap, Wise Women, Freedom House, New Community Shelter, and We All Rise, all in some form have transitional housing programs. Again, it would be important as a community to know who their target population is, what are they transitioning into? Again, the whole point of transitional is temporary targeted housing services, but the goal would be to transition them to something else. And then other permanent supportive housing or other permanent housing. So this is long-term housing that is not necessarily permanent supportive housing, but it's also not necessarily rapid rehousing. It may or may not include supportive services. So in that way, we have EPH again. We have ICS's Family Unification Program vouchers, ICS, the Emergency Housing vouchers, New Cap's recovery vouchers, and then Vivint Health, all of which are providing permanent housing. Whether or not there are supportive services involved depends on each one. And then I have a slide that is specifically just about Vivint Health. In many communities, folks seem to be less aware of the services that they can provide. So we have an entire slide on them as a statewide organization, keeping in mind that the people that are enrolled in any of the programs have to have verification that they are living with HIV or AIDS, but they have a whole bunch of different types of funding to do, as you can see, prevention, short-term rent assistance, our tenant-based rental assistance here, case management, tenant-based rental assistance, and their homeless status. Here's any of the categories. Here's chronically homeless, and here's 1, 2, or 4. So knowing that that is also a resource that's available to you, and in Green Bay, you have a Vivint Health office. They don't have offices in every community.
And I would also mention, so Corin's on the Zoom as well, but in Brown County and in one other community, I'm not sure which one, Vivint Health is also offering like 100,000 plus in matching funds for our COC youth rapid rehousing programs.
Yes, that is true. Both in your House of Hope's program and then in Eau Claire, they are also providing matching funds for the permanent supportive housing program run by Western Dairyland. And that occurred in the last competition, which was fantastic, not only because we got 14 points in the competition towards the COC, but also made it possible for those 2 projects to get funded by being able to demonstrate that they had healthcare leverage. Vivint Health is a healthcare organization, or considered one, at least for HUD's purposes, so it counts. But that's a good point. Thank you. All right, next up, we're gonna switch over to data-driven decisions. So each of these boxes represent data that I have or brought together to share with you all. Some of which is in a handout and some of which is in the slides. Again, it's sometimes hard to share information in slide format, so I will make sure that you have access to both. This is the first one. So I'm going to do this so that I'm hoping you can see it and I can slide over it. So this is people served, and this is people served annually, so it's called annualized data. It's 2021 and 2022. Only people served in emergency shelters, street outreach, or transitional housing, because those are the three entities that are considered homeless in those years in HMIS. So we know that this is not everyone. It is going to be an undercount of the people that are homeless, but this is a place to start. So you can see the difference between 2021 and 2022 when we just look at the total number of humans served. The number of people dropped between 2021 and 2022. Here's the number of people that are 18 and older are considered adults. Here's the percentage of those adults with a disability. So while the number decreased, your percentage of those with disabilities increased. The largest age group that are being served are the 0 to 17-year-olds. The second, which are part of families for the most part. Then the second largest age group is in 2021 and 2022, your 35 to 44-year-olds. 419 people in 21 and 345 people in 22. Breakdown by race, predominantly white, both years, with Black or African American coming in number 2, American Indian or Alaskan Native coming in number 3, and identifying as being multiracial coming in number 4. Percentage of those identifying as Hispanic or Latino dropped from 14% to 11%. You have kind of a almost an equal mix of gender, both male and female, in both years. And then if I scroll over here, I can show you this is the number of veteran clients and the percentage of veterans that of all adults that were veterans. So, 7.5, and then the uptick to 8.5. Your clients fleeing DV. Now, keep in mind, this is as reported by HMIS. So this is not the same thing as the clients being served by Wise Women or necessarily by Golden House. Clients in youth households. This one is interesting to me that while the number decreased, the percentage of total adults actually stayed the same. And then the number of people permanently housed by homeless providers identified as in emergency shelter, street outreach, or transitional housing was 582 in 21 and 435 in 22. So that is a glimpse of the people that were served by these programs. The second slide is those that were served in a rapid rehousing or permanent supportive housing program. Just looking at those two. Same setup, 21 and 22. I think this is super interesting. So I'm gonna scroll back here. The number decreased in the total number of people that you all saw in emergency shelter, street outreach, and transitional housing, but it increased in the number of people served in rapid rehousing and permanent supportive housing. It went from 376 to 450. The number of people with disabilities, the actual number stayed the same. Interesting, though, that the percentage of those that are 18 and older actually decreased a little bit. Your largest age group continues to be the 0 to 17-year-olds. The next largest is different. So in 2021, it was the 25 to 34-year-olds, but in 2022, it was the 18 to 24-year-olds. This is race identification. those identifying as Hispanic, Latino. Whoops, sorry. And then gender is different. So if you look at those, again, interesting to note, 55% were male, 45% identified as female. But in the housing programs, it's 49% male, 50% female, and 1% transgender, with no transgender identified in the emergency shelter, street outreach, or transitional programs in either year. So when I come over here, this is your veterans, DV, and youth households. So when we look at, I'm going to go back to this for a second. When we look at each of these data-driven decision components, not one of these should dictate the approach that a community should take to providing services. They're all important because they all tell you something about your community. So this was just one piece of it. Second piece of it is migration data. When we talk about migration data, what we're talking about here is this belief sometimes from folks that the people that are experiencing homelessness in our community aren't actually from our community. You know, they're coming from someplace else. Well, in 2021, of all the people that were served in emergency shelters, street outreach, or transitional housing, 92% of them came from Brown County, from the Brown County Coalition. From those that came from outside of the Brown County Coalition, 2.6% came from the Fox Cities, 1.3% came from the Northeast Coalition, and less than 1% came from all these other coalitions. Of the people that left emergency shelter, street outreach, or transitional housing, 93% of them remained in Brown Coalition, with 2% leaving for the Fox Cities and less than 1% leaving to go to one of those other coalitions. When I looked at 2022, rather than doing another slide, I put down here, I don't know if you can see it, data from 2022 shows approximately the same percentage that are from Brown County that stayed in Brown County. So this data, again, what we tend to use it for is to demonstrate that no, in fact, the people that you are serving are in fact from the Brown Coalition. Any questions so far? Then I'm going to jump into the point in time.
There's one question from the chat. Are any out-of-state folks captured in the migration data somehow?
No, they wouldn't be able to be, predominantly because the HMIS system is only for our border, so Wisconsin. Although also now we are having a relationship with, through HMIS, with the Rockford COC in Illinois. But unfortunately, what the data pings is whether or not somebody who is served in one of those places had an address or had a connection to a provider or service in that community in the HMIS system. So if they didn't, it's not going to show up because we can't see information from Minnesota, Michigan, Illinois, wherever. Does that make sense?
Yeah, hold on one second. We have another question.
Oh, sure.
Hi, this is Jeremy Crowell from Brown County Health and Human Services. So the question that I have then is, when a person from out of state presents here and it doesn't have housing and begins services here, how is that person then entered into the system, and do they then show it from HMIS perspective as originating as a Brown County person?
That's a good question. So, and I am not a data, like I can share the data, but this is not my data. So this would be probably an ICA question. So the Institute for Community Alliances question. What I understand from the questions I asked of them is if they using your organization or using your coalition, for example, if they first present at, say, St. John's Shelter, and that's the first time that they presented anywhere, and then they went from there and then they were at New Cap, for example, they're going to show up on this right side right here as somebody that exited an emergency shelter in Brown, and then they stayed in the Brown coalition. They're going to show up here. Does that make sense? Of the people that are served here, I don't know how they show up necessarily in this, because they wouldn't fall under any of these categories unless they made a pit stop in Milwaukee, for example, prior to coming up to Green Bay, or they stopped in Madison, for example. If they did, then if they got services any of those places, then it's going to show them coming from one of these. Does that make sense?
Yes, it does. Thank you.
Yes, thank you.
No problem. They actually have like a funky graph that they can show. I find it a little bit confusing, so I put it into words. But if you want that, it's certainly available if you want to see it's like a pictograph, I think is what they call it.
Yes, and we link it every month in our agenda for the coalition meeting.
Gotcha. Perfect. Okay, I'm going to jump into the point in time then. As part of this, again, I'm going to switch to the handout. So you're going to get this as well. I will make it bigger. In the handout, I talk about, I say the same thing I said before, which is there's multiple ways to look at this data. So the point in time, I kind of do a little explanation about what it is, so that for folks that don't know. And then I gathered, let's see if I can show this to you in a kind of a good way there. So this is Brown. The table shows the data collected from the January counts from 2014 all the way to this last count, 2023. And it's the number of people, not the number of households. So starting with 2020 or 2014, going all the way to 2023. Down here, I have what the acronyms stand for. So this is emergency shelter, transitional, unsheltered, and then the total. In purple, if you can see it, tells you when you were at your most. So in 2020 or in 2016, you had 187 people in transitional housing. That number was the largest transitional housing that you had at any point in time, going back to 2014. In last year, you had the largest amount of folks in your emergency shelter system at 388. This past January, you had by far the largest unsheltered population that you've ever had, with 48. And then down here, looking at the table, is showing you just the unsheltered data from the July count. Remembering that we didn't do one in 2020, not on the same kind of scale. So I don't have that. But in 2021, you had 41 people, which was the largest number of unsheltered for the July count. Last year, you were down to 40. And then obviously in a few weeks, you'll find out what you have for this year.
Carrie, are you seeing similar trends with unsheltered people in other communities?
Yes, absolutely. Across the entire balance of state, we've had a tremendous uptick in the number of people experiencing unsheltered homelessness in the balance of state, pretty substantially, like an uptick of almost 100 to 150 people in a way that we never had before. Starting in 2021, although you can see a little bit of a spike in 2022 or 2020 at that January count, which was before COVID ruined our lives. But then rolling into today, it's just been a steady uptick, which is super sad and frustrating from a data perspective. Also for the humans sleeping outside, because if you look back at 2019, I think this is pretty indicative of where we were before COVID. You know, you as Brown County have the largest homeless population of any of my coalitions in the balance of state. using you as kind of a litmus test here, but this is what we were seeing. 2017, 18, and 19, you're seeing a consistent decrease. Decrease in shelter, decrease in transitional, decrease in unsheltered. That is where we were heading, again, before COVID kind of ruined our lives. And now we're in this very unprecedented place where we're in the largest numbers we've ever had, kind of across the board, without the housing resources to be able to address it. That probably doesn't make anybody feel good, but that, yes, from perspective, that is where everybody is situated. You just have more of it than many of the other coalitions.
And we have more of it because we have more people in general.
Yes, I think many factors play into why you have a larger homeless population. One of which is you are a giant city and giant county. Number two, you have a lot of providers and a lot of services, and that isn't a bad thing, but it is, you have a hub of services, not just homeless services, but all the other kinds of services too. So yes, I think all of that plays into a role. You know, the second largest coalition with the most people experiencing homelessness is your direct opposite, which is the western side of the state. That coalition, West Central, the largest city is 14,000 people. It is 7 counties, all rural, and they have the second largest homeless population of all the coalitions. They definitely do not have the second largest population of human beings, homeless or otherwise. So it's a very interesting perspective when I have both of you, like both of those coalitions that are totally not alike at all, having that number of people experiencing homelessness. Okay, so then I'm going to switch back to the slides for a minute because graphs show up better on slides. So here's the point in time, January count. Looking back, I only went back to 2018 because honestly, if I go back further than that, the lines get it gets a little bit more challenging to see. So I only did to 2018 to show you kind of the trend. The blue line is emergency shelter. The green line is transitional housing. The purple line is your unsheltered, which you can see this gradual uptick. And then the total, if I combine all of it, you can see here, you were going down, then up, then plateaued, then giant up, and now kind of a slight down. If I look at unsheltered and just unsheltered, the blue line represents your January count, and July represents your, or red represents your July count. So again, decrease and then a giant increase. In July, you were on a slant that was, it was higher. Then we took a pause in 2020, and then you have 21 to 22, just a tad down. We know that's one person. And then obviously we don't know what a couple of weeks from now will show. The point in time is an interesting data point. Again, it is not the whole of all data, but it is a part of it. We've been doing it for a really long time. So to be able to go back and look at the same or similar process back 8 years tells us trends, shows us trends. It's also the only data point that puts together those that use HMIS with those that don't, with those that are not in a service, so unsheltered. It's the only data point that grabs all three at the same time. Okay, if I switch back, the next data piece that I want to share with you, and I believe you already had this presented to you, which is the race equity reports. So I just grabbed a couple of pieces of it because it's a layer that needs to be attended to and pay attention to as we're talking about ending homelessness. Brown Coalition, 76 out of every 10,000 people in your community are experiencing homelessness. It is significantly higher than the statewide number of 36. In your coalition, people that are identified as Black or African American are 14 times more likely to be homeless than white. Those that are Native Hawaiian or Pacific Islander are 7 times more likely to be homeless. American Indian or Alaskan Native are almost 10 times more likely to be homeless, and so on. So here's the graph for ethnicity. If you're Hispanic or identify as Hispanic or Latino, you are 1.6 times as likely to experience homelessness. And then on the next page, the part that is really hard, I think both those race equity reports are challenging, but also this in and by itself, despite the fact that people that are identify as Black, African American, Native Hawaiian, Pacific Islander, any other non-white group, even though they are more likely to become homeless, show up in your shelters, be connected by outreach, end up are not more likely to end up being served in housing programs. And that is a challenge, and that is a systematic challenge that almost every coalition who had these reports done. So we had them run for all 21. Almost all of them show the same thing. And that doesn't make it right or good or okay. It means there's something that we need to look at and do. Why? Why is it that they are more likely to become homeless, but less likely to actually get served in a housing program? Same is true for ethnicity. Despite the fact that those identifying as Hispanic or Latino are 1.8 times, so almost the same likely as those that are not Hispanic or Latino showing up homeless. 84% of those served by a housing program are not Hispanic or Latino.
Karen, we have a question real quick.
I'm sorry, what?
We have a question.
Oh, yeah.
So, if they're less likely to be served by housing programs, is that likely due to the way they're responding to the VI-SPDAT? And is that being addressed when you're looking at redoing the VI-SPDAT?
Yes, and so it might be because of how they're responding to the assessment. It might be because they are less likely to seek services, or the honest answer is, and this is one that I'm afraid of, because if this is true, then it is indicative of a much bigger change that we need. Are they less likely to get housing services because there is some level of bias or some level of other thing that we aren't looking at, when the majority of housing programs are run by people that don't look like the clients that they are serving? Which is why we're seeing a federal push to make sure that we are incorporating people with lived experience, people that identify under BIPOC, people that are identifying LGBT, to be in positions of power and service back to the communities, because they look more like the people that we're trying to serve. So that is something that we are all trying to figure out, if that's true. The assessment replacement, one of the reasons it is taking so long is that is exactly why, that's exactly one of the things I'm worried about. So one of the things we did when the group got together to work on the assessment is we had them basically take an identification survey, not to say the words out loud, but to be able to identify, what race do they identify? What sexual orientation do they identify with? And ask a variety of different things that help us understand, is the group that is building this assessment represent the clients that we are trying to serve? Or are they all white women? I mean, like, we need to make sure that we are looking at all the different ways that people present different. And unfortunately, what we found out through the survey is, the majority of the people participating on the call were white women. And not that that's a bad thing, but we are missing other perspectives. So then it became, what are we missing? And how can we reach out to? So we started with the DEI committee to ask the leaders of that committee, what is the best way to handle this? What do we do? How do we bring in or try and intentionally target, and not in a bad way target, but get that other perspective? So that committee or that group that assessment has been going out to very specific intentional people to try and get more perspective that isn't just white women. I don't know if that answers your question or answers it too much, but that is our hope.
Thank you.
Yes. Okay, the next bucket is coordinated entry. So we're going to switch back to the slides. Here is coordinated entry. So looking back, I looked back at May 2020, May 2021, May 2022, and then we're doing the presentation in July, so July of 2023. The reports that were run for the coordinated entry stuff were run 2 days ago. So it's pretty fresh data. And this is what it tells me, which is super interesting and super not the same trend that we are seeing as a balanced state as a whole. And it's honestly one of the first coalitions that I have noticed or have seen this kind of thing happen. So I don't know if it's an anomaly. I don't know if it's a trend for the future. I have zero idea. But it is new. For the most part, overall, coordinated entry from a balanced estate perspective tells us that the people seeking services, 75 are identified in assessed in coordinated entry. 75% are in households without kids, and 25% are in households with kids. And you were in that zone in May of 2020, May of 2021. You were dipping a little bit in May of 2022, and now looking at your data 2 days ago, you are very much going in a different trend. 75-25 is been the split or the difference in the 6 years we've been doing coordinated entry. Your data now tells us in brown that 59% are households without children and 41% are households with children. That's a very different breakdown. I don't have an answer to that. I have some questions that I think we'll be able to talk a little bit more when I go through some of the other slides, but I also think it has to do a little bit with who is referring into the system and who is no longer a door into your system. And that unfortunately, as a result of that, or a decrease in those access points, we're going to run into some challenges with not being really reflective of the full homeless population. So here is what the report shows as of, like I said, 2 days ago. Of the 189 people that are on the coordinated entry list that don't have children, 20 are chronically homeless, 3 are veterans, 17 fall into that youth category, 24 identify as fleeing or attempting to flee DV, but reported in HMIS. Your average length of stay is about 172 days on the list. Your longest, you have somebody on the list that's been on the list for 1,454 days. And you have 63 people that have been on the list for more than 200 days. For households with children, of the 130 households, 6 meet the chronic homeless definition. 1 is a veteran household. 10 are the youth between the ages of 18 and 24. 36 domestic violence survivors. The average length of time on the list is 125 days. And there's been a family on that list for 640 days. You have 27 families that have been on the list for 200 days or more. Now, if I take those human beings and I place them in a level of needed support categories, so I say of these people, looking at chronicity, looking at disability, and looking at the number of months homeless, these are the most likely interventions that would be needed to address their homelessness and provide them an outlet or permanent solution. Okay, so of all those humans, you would need to end homelessness for everybody on the list 2 days ago. You would need, and I'll make it a little bit bigger, you would need 39 more permanent supportive housing slots. That's the leasing money and the case management money for 39 more units. You would need 153 more units of rapid rehousing with intensive case management. This is not ESG. This is more in line with House of Hope, New Cap, and Golden House's rapid rehousing programs that are more intense case management. And then you would need 127 more units of lower, lighter touch rapid rehousing. This could be ESG, depending on whether or not it is addressing the populations that need it. You have about 56 households without kids and 71 households, 56 without and 71 with. So if you do ESG rapid and it's all going to households without kids, you're missing that 71 with kids, or vice versa. This is a pretty common breakdown across the balance of state, that the rapid rehousing with intensive case management is the largest need that we have, which requires both units and case management at a higher degree. It's also the fastest growing group. In addition, this one, as of COVID, has gotten larger almost across the board in the balance of state, which is the lighter touch rapid rehousing. Are there questions about this?
No, but do we want to circle back to the comment that the data that we talked about earlier? Just to bring it to Carrie's attention.
Oh, so Carrie, at the meeting earlier today, we did talk about some of the issues that we're having with the length of time that people are enrolled in housing programs without being housed. And some of the data that I think would be really helpful for us to see as a community would be like the percentage of people enrolled in housing programs who are never housed. I know in our community, just from reports we had to do in the hopes of getting a waiver for fair market rent, we did see an increase from like 15% of clients being enrolled in programming and not being housed to over 50. So
yes. Yeah, no, that is a good point. And this is gonna, so here's the deal. We do have that access to those reports for length of time homeless, and looking specifically at programs that enroll, but then they're never housed. And we use it in the connection to the ranking of the COC projects. That doesn't mean it's the only time it can be looked at. You absolutely can look at it in the sense of a marker for you all. And I'm going to guess that you're going to see, you said an uptick into 50%. I would suspect that we're going to see that across the board, that there are far more people absolutely being enrolled into these housing programs, but can never find housing. And the question becomes, so the questions from my perspective are, what is the level of effort being placed by the housing agency to help the people find housing? That is not equal across the balance of state. There are some agencies that hand people a list and say, good luck. And there are agencies that are doing everything they possibly can to help people find a house or an apartment, or there's lots of engagement there. How long are they letting people look? There are some agencies that have said, 45 days, 60 days, and then that's it. Too bad, you go back on the list. There are others that leave them open for 8 months. They may move on and enroll other people while those folks are still looking, but they don't just end their services because they haven't found housing. So I don't think that we have a very good process in place right now in the balance of state to be able to say everybody is getting access to the same level of service once they're enrolled in a program and are being treated the same. And that is definitely something on our end, on the balance of state staff end, that we are looking at ways of setting some standard best practices. And actually, I'm not even going to say best practice. I'm going to say some standards around what that needs to look like, to ensure that programs, especially when it comes to scoring, that programs that are being scored well or poorly, are all being held to a same or similar standard, if that makes sense. I don't know that that really answers your question, but it is definitely an area that we didn't predict. And when I would have looked at this data 4 years ago, this window wouldn't have been as large as it is now. Those that are enrolled versus housed.
Thank you. Yeah, we did talk about as a coalition, setting some standards for what that looks like here in Brown County.
Yeah, that's fantastic. And I will also say, not this should make anybody feel great, but overall, when I look at the balance of state numbers in total for rental assistance, collectively for all the COC funded rental assistance programs, including the DV Rapid Rehousing Grant, we're going to be turning back hundreds of thousands of dollars in Wisconsin in rental assistance back to HUD because we weren't able to use it to house people. And that's terrible. It makes me sick to my stomach to know that we could have and we can't, because of something that is, I don't want to say it's out of our control, but it would be really nice if we could get some help in the housing part of it from landlords or, magical apartments.
Right, Carrie, with that extra funding, will there be an opportunity for other communities to pick up that funding? That
Not the way that HUD has it structured. So if you have a grant and you give up the money, like you do your APR and you just didn't spend, $300,000, that money just gets absorbed back to the federal government. It is not ideal.
Do they have an opportunity, those agencies, to ask for help?
Do those agencies have an opportunity to ask for help to transfer the funds before they give it up? Like to work with other communities or
so it's complicated in that way because the agency has a direct grant with HUD to spend that money. So they can't just hand it over to somebody else to spend a part of it. Like they can't just say, oh, I'm going to give you in the agency some dollars that I couldn't spend. It doesn't really work that way. Now, what I will say is that HUD doesn't stop you from creating partnerships to be able to spend that money. So for example, if I'm an agency and I am the direct recipient with HUD, because it makes a difference if you're, a subcontractor. But if you get the contract with HUD and I'm an agency and I'm looking at my stuff and my case managers are just not being able to house people. So I want to enter into a subcontract with agency C over here because they have a really good reputation to be able to do housing navigation and that they can help get people housed. You can do that. Absolutely. There's a process by which you might not have had a subcontract with HUD, like you didn't identify a subcontractee in the HUD application, but you want to, and you're mid-cycle, you absolutely can do that. That agency would become a subcontractor of you as the lead.
I would like some there.
Yeah, people, I think we're just really curious as to are there ways that we can support the agencies who are having that issue? Can you make it public who's not spending their funds out so that their communities or even our community can help surround some of those organizations? Yeah,
so I don't know about the direct grantees. I have to think about how the best way to do that. But I can tell you, and I am very comfortable speaking about the domestic violence rapid rehousing grant because we as the balance of state are the lead. That grant is $2.1 million and that grant ends September 30th, and we have spent less than half of that $2.1 million. We are likely going to turn back an obscene amount of money. And so the subrecipients in your area, Golden House is our rock star. They spend the most money. I mean, they by far are always like, yep, we'll take more, we'll do more, we'll house more, we'll help more. They are a bit of a gold star in that way. But I'm telling you that if they could double the number of people that they could house, we have funds for that. We have a ton of money.
Are we seeing HUD being able to, I don't know, respond to this kind of crisis where we're not able to spend that money by providing money for acquisition or development?
Not at this point. I mean, what we're saying and what they're hearing from communities across the board, it's not just Wisconsin, is the same problem. It's the same situation. But no, they aren't. They're not proactive, they're reactive. So they have to get the money all sent back and have advocates yelling and not yelling, but speaking loudly in some kind of advocacy type way to be able to get them to be able to shift. And it isn't just them, it's Congress that has to be changed. Honestly, because they're the ones that appropriate the money in the way that they do and require us to compete against ourselves for the funds and create the rules. So they're the ones that dictate this whole process that we're talking about right now. HUD just executes it. So what I would say is this. There have been lots of NOFOs that have come out, so notices of funding that have come out to try and address some of the challenges we have. One of them was the special NOFO. One of them was the unsheltered NOFO. Balanced Estate Board voted not to proceed with either of those funding opportunities for a lot of different reasons. So that came and went. There are a few others coming up, one of which is specifically around permanent supportive housing. Now, this is a different funding opportunity, and it's around expanding permanent supportive housing programs to include site-based permanent supportive housing, to be able to have those kinds of agencies doing permanent supportive housing in housing that they own. And that is something in that leasing environment that is new. Right now, you would have to ask, so in your community, for example, NewCap, if NewCap owned units, like bought and owned units that they rehabbed with other magic dollars, they could not put their permanent supportive housing clients in those units unless they got a waiver from HUD. And that is not always an easy process. It is something that can be done, and I encourage it. But this other NOFO would be an opportunity for an agency, for example, NewCap, to be able to write for specific funds to expand their PSH grant, to be able to have more units that they could offer to people, especially those that are going to be really challenged to find market apartments out there in the world, right? They have terrible backgrounds, they have terrible credit, they have terrible housing history, but the agency themselves may take a risk that a regular landlord might not. Does that make sense?
Yes.
Those are definitely things that are coming out as a response to this understanding that we need more housing. Home ARP, if that ever gets released, while Brown itself, or the city of Green Bay itself, wouldn't be eligible, Brown County on the outside would be eligible to write for. And one of the things they're looking at is exactly what I just said, the permanent supportive housing connection and being able to expand units, building or rehabbing units to be able to use for permanent supportive housing. It's only $40 million, and I say that because it's not enough to provide housing to the entire Balanced Estate, or it's actually statewide. And we know that that's going to take a hot minute. So maybe 5 years from now, those folks might have options for housing. It is a struggle that doesn't have an answer right now. And it is really, really hard to look at these numbers and know the direction that needs to go, and not have the resources to do it. So a big part of my job this morning alone, for example, was sitting on a DHS call with a whole variety of humans talking about how do we get hospitals more involved? How do we get healthcare more involved? They have funding to be able to do things. How do we access the parts of Medicaid that we can access? You know, what other options do we have looking outside of the traditional homeless service system for housing support? I don't have a magic answer to that right now, but it is definitely something that is going to take a collective voice, especially if we're talking about the repurposing of unspent COC funds. That takes congressional authority. And so whenever anything takes congressional authority, it means advocacy on top of your day job.
Okay, thank you, Carrie. I am gonna point out that it is 11:30.
Sure.
I do know that some people probably need to leave, but this is a really important conversation to continue to have. So yeah, I just wanted to say that.
Absolutely. And I know that it's really dense with information, so I apologize. But I wanted you to at least have the information. If you want me to keep going, I'm happy to do it. If you want to schedule a part 2, I can do that.
We have the room for another 30 minutes.
Sure.
We can just, if people want to stay, they can. This is being recorded, so it can go out.
Hey, that's perfect. That sounds good. So this slide for coordinated entry has some definitions so that if you're not familiar with the acronyms, it's available to you. Here's a place that I do think some expansion could occur. So when I look at the referrals from 2 days ago, the percentage of people, like where these referrals are coming from, for households without kids, of all 189 of the referrals, 59% came from NewCap, where everything else was a much smaller percentage, with St. John's coming up with 14, and then other coalition agencies. I mean, recognizing that Northeast and NWISH is NewCap, so the majority of these are also NewCap. Outside of the east side means someplace on generally the west side or north side of Wisconsin. House of Hope was 5, Fox Cities agencies 4, and Winnebago Coalition 4. You don't have a lot of doors to your system. Compared to other communities, you have agencies that are doors to the coordinated entry system that are homeless service providers, like your typical homeless service providers, but you don't have a lot of other doors coming from other systems of care or other organizations. Households with kids, again, NewCap presents the largest percentage, House of Hope second, and then it breaks down from there. So just to show you where those referrals are coming from, which agencies. Pretty graphs and charts. This shows you looking at households without kids. May 2020. That's interesting. This should not be February. It should be March of 21, May 22, and July. This is your trend information. Again, very strange to me, but it is what it is. PSH took a big dive over a year, like the need for it. Yellow is rapid rehousing with intensive case management, which also took a little bit of a dive, but then it's been increasing and plateauing. And then regular rapid rehousing took a huge increase, and now it's starting to taper down a little bit. This graph is just to show it to you in another way. Some people like these kinds of graphs better. This one is households with kids. This one's also wildly different. So PSH, again, kind of plateauing and then dipping down. The yellow represents rapid rehousing with intensive case management, which shows you a much bigger need. And then regular rapid just spikes all the way up there. And this is just households with kids. So here is the bar graph. And then this is total. So taking everything all together, this is what it represents. These are the number of solutions needed. And then blue is households without kids. And this orange is households with kids. This is looking at the comparison between the numbers and data gathered during the point in time and the data gathered at the coordinated entry level. This is also where I see a concern, if I'm being honest. Look at your January PIT numbers. You had 389 households. And in coordinated entry, you have 319 households. So that seems kind of comparable. But look at the number of households without kids. In the point in time, you were able to identify 330 people. But in coordinated entry only exists for 189. What happened to all of those other human beings? Now, granted, this is January to July. So maybe theoretically they got housed and that's why they're not in the coordinated entry world. I will be super interested in looking at this when we have the July point in time data to lay it across this coordinated entry data and see if it's still true, or are you missing a group of human beings that are counted during the PIT but not included in coordinated entry? Looking at your gender breakdown, 73% male versus 61% female, with the households without versus with, similar for coordinated entry. However, higher, like this percentage is higher, 87%, with households with kids in coordinated entry are identified as female. And then Hispanic, Latino, it's the same kind of breakdown, gender, similar. Also, I think it's very interesting. The majority is in your community is white. Households without, households with generally is the higher percentage, except when it comes here to homeless services. At the point in time, actually the percentage is Black African American, represent a larger population of the people identified with children that are homeless, similar as those identified and included in coordinated entry referrals.
Carrie, I have a quick question about the gender of point in time versus coordinated entry.
Yes.
Does coordinated entry count the genders of all of the other members of the household, or just the head of household?
Just the head of household.
And then the point in time is all of the children as well included within
Yes. Yep.
that household. Okay.
Yep. Up here, just so that we're clear, the number of households, this is, just the identifier as the number of households. This says number of people. This should say number of households. Does that make sense? Coordinated entry does it by households.
Yeah, it makes sense, because like when I look at House of Hope's data gender wise, we have a lot of female headed households, but then when we look at the total people, there's a higher percentage of males served because of the number of male children in those households.
Nope, that totally makes sense. I think this data point is concerning to me also, and again, maybe it'll look different in the July point in time. But you have 65 people identified as chronically homeless in the point in time, where you only have 20 identified as chronically homeless in the data from coordinated entry 2 days ago. So maybe they all got served. That'd be awesome. But it feels a little like maybe people that are identified through the point in time aren't necessarily getting access to coordinated entry. That's the question I would ask. I'm going to go back to the data for just a second. System performance. I'm going to go a little quick just because, time. System performance, I lay out what the definition is, like in basic terms, for you, and then I show you a grid. So for each one of the system performance, so this is length of time homeless. I show you what Brown Coalition is, but then I also show you some other communities that are similarly situated. So Fox Cities being the closest city to you, bigger city. So showing you what it looks like in the Fox Cities, Kenosha, in the Cooley area, which includes La Crosse. And they have by far the largest unsheltered population in the entire Balanced State. And then Dairyland, which is the Eau Claire area. So for every system performance measure, it includes all of those coalitions as a comparison. So these are the number of days homeless. Remember when I said that HUD's goal was 30 days? Well, your folks are experiencing an average length of almost 77 days homeless. The only coalition that even comes close is Kenosha's. The overall change from looking at 2018 to today, you've had a 57% increase in the length of time homeless. It's a pretty substantial increase when you look at the other communities' increases. Here is your data for each of these date ranges. Then you look at how long are people in shelter. So this I find interesting to me. It's almost the same in every coalition, that the most people spend less than 7 days in shelter. The next largest grouping is the ones that are in shelter for about a month or two, with the last normally largest group being those that are in shelter 3 to 4 months. Interventions for the people that are only in shelter for 1 to 7 days should be different than those that are in shelter for much longer. These are the folks that we should be supporting to self-resolve. Maybe if there was magic funding for universal diversion, these folks may never have hit the shelter in the first place. I don't know that for sure, but that across the board for every coalition is the largest number. Reoccurrence, those are the folks that successfully exited a program and then showed back up homeless in Wisconsin within 2 years. For you, the percentage of return is about 23.5% coming out of an ESG or an ESG, emergency shelter or rapid, and about 12% coming out of permanent supportive housing. Those are actually pretty good numbers comparatively to some of the larger communities. And then I have like what the words stand for, and then historically. You have done a really good job with your PSH. Once upon a time, your returns to homelessness were over half for those exiting successfully from permanent supportive housing. First-time homeless, you are in an interesting position. It's a little bit different. I mean, you and the Fox Cities are kind of one and the same here. Your shift, you've been there before. The percentage of people that are new to homelessness, generally people talk about, the people that repeat service and they know all the services, they know where to go, they know where they're supposed to go, etc. But not if your first-time homeless number is 80%, then that's not true. It means 20% of the people that are homeless probably know the system. 80% are new. So in your community, 65% are considered new and 35% are considered having been homeless in the recent past. You could argue that they know the system or know of the system or know who and how to navigate. Exits to and retention of permanent housing. So are people leaving programs to go into something permanent? When we look at your exits from just emergency shelters and rapid rehousing, you're sitting at almost 27% of the people that leave go to something permanent. When we look at PSH, that includes both the people that are still in PSH or they leave PSH to another permanent housing. You're up close to 97%. Those are good. I mean, that's a good thing. Again, once upon a time, in 2018 and 2019, you were even a higher percentage. But in comparison, you're kind of in the same boat as most other folks. Another data point is the Alice report. So Wisconsin is a state partner of the United for Alice. Alice is looking at that space between those experiencing poverty and those that technically by the federal level aren't under the federal poverty level, but still can't meet their basic needs. There isn't 100% correlation between that population and becoming homeless, but we know that they struggle to pay rent. We know they struggle to pay for food. We know that they are on the brink. So if we're looking at going upstream, this is indicative of those folks where targeted interventions could really be helpful. In the Brown Coalition, 11% of the population falls under the poverty level. That's in line with Wisconsin's state average, but your ALICE threshold is 25% and the state average is 23%. So in total, you have 36% of your population of human beings living in Brown County that struggle to pay for things, basic necessities. It looks different depending on which community you live in within Brown County. So if you go on to the report, you can look at all of the different subdivisions. I pulled up the ones with the 5 highest below ALICE threshold and those with the lowest. So Green Bay, the city, Denmark, the village. I'm going to butcher the name of that village. Pulsaki Village and Bellevue Village, all being your highest below ALICE threshold. So folks that are above the poverty limit but can't meet their basic needs. And then the 5 that don't have very high percentages of this population: Holland, Sumico, Rockland, Lawrence, and Glenmore. When you scroll down, you can look at
Hey, Carrie, can I just make a point real quick about
Yes.
that poverty? The bottom 5 do not have public transportation.
that's super interesting.
That's all I
That
just
is super interesting.
Neither does Pulaski.
Oh, Pulaski also doesn't have public transportation, but or Denmark, but those are super rural. They're more rural.
Sure. Yeah, the report, and I have a link to it. You can see all of the divisions and where they fall. When we scroll down to the next one, you can see that things are not the same for all races or ethnicities. This dark blue is the poverty. So more people identifying as Black or African American fall under the poverty limit. When we look at ALICE, definitely falling under that marker, identifying as Black, African American, or American Indian, Alaskan Native, definitely fall more under that line. Above ALICE, meaning that they can theoretically meet their basic needs, those identifying as Asian and those identifying as white definitely fall in the higher category. And then there are also differences when we look at the types of households. So those that fall under the below the ALICE are our single female headed households with children, followed by our single male headed households with children. And then when we look at the age grouping, I think this is super interesting and definitely a point of more attention is being placed on the our seniors and their experiencing of homelessness. And what does that mean when our homeless system isn't really designed to meet the needs of people that are getting older? Your below ALICE threshold are the highest for people under the age of 25 and over the age of 65. So like your absolute edges. And what does that mean for our system and our targeted prevention services and where the majority should be placed? Especially if you overlay this with the data I shared earlier, that your largest populations of people experiencing homelessness tend to be within this range, the 25 to 44-year-old range. This just talks about what it means to have a survival budget and what's included in Brown County to be able to meet your basic needs, which includes housing, childcare, food, transportation, healthcare, and a basic smartphone plan. You would need to make $26,340 as a single and $59,000 as a family of 4. Compare that to the federal poverty limit of $12,000 and $26,000. If you want more information, there's a link. And then the last data point I have in here is for the National Low Income Housing Coalition, which talks about how much it costs to rent. So looking in Green Bay, the city versus Brown County, the total number of households, and then the total percentage of renters within each of those. This is your fair market rent for a 1-bedroom, fair market rent for a 2-bedroom. Annual income needed to be able to afford a 1-bedroom is a little over 30,000. Annual income needed to afford a 2-bedroom is over 38,000. What does that mean? It means if you're making minimum wage at $7.25 an hour, you would have to work 81 hours a week in order to afford a 1-bedroom apartment that meets FMR if you were only going to pay 30% of your income to rent. If you want a 2-bedroom, then you've got to work 102 hours a week. Somebody on minimum wage can afford about $377 or $377 a month in rent. Your FMR is well over that. And then someone on just SSI can afford to pay $299 a month in rent. The other kind of fun piece that I include in here is when this is not Brown County specific, this is Wisconsin. When we look at where people are most employed and where and how much they make, you can see all of these jobs. And then this is the 1-bedroom wage. Will fall way below. Then to afford a 2-bedroom, all of these, you have enough theoretically money to be able to afford a 1-bedroom, but not a 2-bedroom. And then here are these jobs, these wages, etc. And then there's a link to that website as well. When I walk away from looking at this handout, especially the last 2 bullet points, I'm like, well, no wonder we have a homeless service problem and a lack of housing problem and et cetera. I mean, when we look at the wages mixed with the rents, mixed with people that can't meet basic needs, I mean, it all trickles. That's why homelessness is this big, giant issue that can't just be solved by emergency shelters and homeless providers. Like, we need all the other people to be part of it as well. The last things that I'll send with you, one is the homeless definition. Most people are well aware of the HUD homeless definition. Then there's a lot of talk about the McKinney-Vento homeless definition for schools. We like to point out that, number one, that definition was never designed to provide services, housing services. Number two, it's an identification that's done at the beginning of the school year, and that it only happens once. So if a family is identified as homeless but then gets housed, those children are considered homeless for the entire school year. That there's a difference. And then one of the other parts to that, I'm sorry, is this unhoused versus homeless. And I don't know if it's real in your community or not. We've certainly heard it a lot on the western side of the state, this sudden desire to call people unhoused instead of homeless. And so there's a handout that explains some of the unintended consequences when we choose different words, that they mean different things, and to remember that homelessness is an experience, not who they are. Role of coordinated entry, improving the system, questions to ask. And then oftentimes people ask me, what do we need to end homelessness? So this lays out 5 major things, and then my contact information. Sorry, that's a lot of information.
This was amazing. Thank you so much for taking the time. We'll make sure we get all this information out to the full coalition and all of your handouts, and we really appreciate your time. Thank you.
Absolutely, and I will get it sent. You want me to send it all to you?
Yeah, that's perfect.
Okay, yep, I have no problem doing that. Again, sorry it ran long. If in your further conversations you have questions or want me to come back or whatever it is that you want to do with this information, please let me know.
Okay, thank you so much, Carrie. Everybody have a great day, and we'll see you next month.
Awesome, thanks.